So we're at the AI for Good Summit in Geneva, and I've managed to win another guest, Aral Surmeli from HERA Digital Health. On Digital Talk, we spotlight entrepreneurs, leaders and innovators using digital tech and telecoms to drive global impact in a changing world. Uncovering the unexpected, spotlighting hidden gems, and sharing inspiring stories that shine a light on the most transformative corners of our industry. Welcome to the podcast.
Thank you for having me.
Would you mind just explaining a little bit more about yourself and the line of work you're in?
Yes, definitely. So I am a physician by training, but while I was working in emergency settings and ambulances, I realized the value of public health. So I dived into, public health instead of clinical. So I did my master's in public health at Harvard and currently doing my PhD again in public health at Johns Hopkins University. My area of work is simply using technology in humanitarian settings and refugee healthcare, I would say. So we see how the existing technologies that everyone benefits can be of good for the populations who are displaced.
I think you've answered a lot of the reasons why you're on the podcast by what you just said. But can you tell us a bit more about HERA Digital Health and the project?
Yes, definitely. So we started on the idea of HERA during my clinical work back in Turkey. As you know, the Syrian refugee crisis led almost 4 million people to be displaced to Turkey. And I was working with them in emergency settings, ambulances, hospitals, rural clinics and everything. And the good thing is in Turkey, refugees are entitled to free healthcare, which is amazing. And we always love to see that. But that doesn't always mean access because people, Arabic and Turkish are very different languages. We don't understand each other. People don't know where they can go, which hospital they can go, when they can go. So one of the things we saw was mobile phones were their primary way of accessing information and, being connected to their families around the world. So we thought, why don't we make a simple app that helps them navigate the local health system, help mothers find the free immunization for their children, get pregnant women to go for their pregnancy checkups, because immunizations and pregnancy or, childbirth is where we have the biggest impact on lives of vulnerable populations. So that's how we came up with it. It started as a simple app for refugee mothers 7 years ago. Now it's fledged into a agentic AI chatbot that can do everything the app can do, carry their health records, connect them with the nearest health center, call 911, answer their health-related questions in a context-aware and context-specific way, in a culturally correct way.
Today's episode is sponsored by IFG Consulting Europe, who help operators to tap into technologies to accelerate digitization of the network, drive revenues, and reduce costs by championing promising software providers. Go to ifgconsultingeurope.com to find out more.
And so you mentioned Arabic, so I'm thinking also Arabic lettering is very different as well. So is that one of the challenges you had to overcome?
Yes, when we started this, the coding wasn't as great as it used to be, in Arabic, because the one thing is not just the alphabet, but it starts from right, not from left. So even the UI or user interface of the app would have to change to be aligned. But also, it's not Arabic is the biggest language that we use, but we also use Dari and Pashto for Afghan refugees.
So it's multi-language. It's multi.
Yes, okay. Yes, it is. Yes, I forgot to mention that it's a fully open sourced and free project, so it can be adapted to different contexts. Okay. But yeah.
Fantastic. That's great. And I think it's pretty obvious the impact on society, but you painted a picture of obviously refugees. Do you want to see this project widening beyond, let's say, the Syrian crisis area? And do you see use cases and you're in contact? I guess this forum gives you the opportunity to meet other people who maybe have similar problems and needs? Is that, am I going in the right direction with my thinking here?
Yeah, definitely. So the way I like to see it is healthcare systems all around the world are designed for people who are born and die in the same place, not for people who are displaced. So we need to kind of bridge that gap, and that's where we see ourselves. So Syria crisis is the first context that we started working with, because I'm from Turkey. I know the population. I've worked there and everything. But yes, the goal is to be the connection between anyone who's displaced with the existing healthcare wherever they end up being. It may be a new country, new city, and everything.
How do you validate the people? Because I think that's always a challenge, right? In the sense of authenticating people, their backgrounds, where they come from. I mean, that I'm just thinking, because from the telco context, when you need to buy a SIM, you often need to validate who you are. Do you have a process like that in the app, or is that not so important?
So it's never been a priority for us. Reason being that we know that any kind of gatekeeping decreases access to healthcare. So we want it to be open as much as possible. And a good example of that is, so even though we were working with refugees, 2 years ago there was a huge earthquake in the border between Turkey and Syria, which led to at least 50,000 people dying and everything. And I am actually from the epicenter of that earthquake, right in the border. So, and we had these technologies, and my team was on the ground from day one. I joined them a couple days later, and they're like, Aral, we have this technology that we can navigate to health centers. Why don't we open it to the whole population where, they can find the nearest field hospital? Because you can't see them on Google Maps in an earthquake. So that's something we did and opened it up to the population. But yeah.
Well, I think you just answered one of the next questions, was a real impact in the world, which definitely it seems to have had. And how do people in those emergencies find the app? Because in a way, that's another challenge, right? I mean, you say they've got the mobile phones, but they maybe have never come across you. How do you manage that gap?
Yeah, that's a great question, because that is something that we people who produce the products sometimes forget, because we get obsessed with the product but forget that if they're not found or used by the users, it really doesn't make sense. So that is one of the reasons we kind of migrated to a chatbot, because now the agentic AIs can literally do anything a mobile app can do. So they don't need to download an app, can just use the phone number and just text it on WhatsApp. And the best way to circulate is word of mouth and social media. Once you are kind of in the social kind of like the context of refugee, refugee, like
in their social circle.
Yes, like then refugee mother groups and stuff like that. It becomes super helpful. So that's been the way.
Yeah. That's fantastic. So we're here at the AI for Good Summit. First time here, how are you enjoying it? And you mentioned something about, which I think partially why we wanted to interview you, you've been a finalist in the Impact for Good area, is that right?
Yeah, so this is my first time, and I'm just so happy to be here, because, we are usually exposed to the threats of technology, and just being in the community of people who are using technology for good, saving lives, improving the planet and everything. It's just wonderful, just, being here and breathing the air. Yes, we are a finalist at the AI for Good Impact Awards in the AI for People category.
Okay.
Out of, I think, more than 300 applications, 9 was accepted to be a finalist, and 1 for each category was chosen as a winner. Yeah.
Okay. Well, congratulations on becoming finalists. Our future is the young people. So have you got any advice for young people wanting to use AI for good at all?
Yeah, I would say, and again, this is a common mistake we make. Anytime I say that, this also means that I made that mistake as well. But find a problem to solve rather than a product. And, and once you have the problem, you can find the right product. Don't go the other way around. I would say that's the most important one. And just keep doing the work. It takes a long time, and
Believe in it, right?
Yeah, definitely.
But you've done that, right? You saw a problem and you've gone after it. I think that's the right approach. Given your wide experience, and I think also the area where you're working, are there any particular other companies that you admire in the sector worth a mention?
Yes, one the amazing organization that I would mention is fastforward.org. They are a accelerator and incubator program for tech nonprofits based in San Francisco. They're amazing, and they're supporting other nonprofits to use technology better, or technology and AI for good. They actually have a term called AI-powered nonprofits. They came up with this term, which is amazing. And another one is Nextleaf Analytics, who uses data and AI for helping rural communities connect with healthcare services.
They're very worthy nominees, and I'm sure there'll be people listening who can make use of that as well. What do you think is the most sort of pressing issue outside of the work you're doing now that, the world should be tackling?
I think climate change. And when we talk about refugees, we talk about the end point, right? But climate change is the biggest reason for people being displaced as well. So I think other than what we are doing with healthcare access, climate change or the climate crisis is the right thing to tackle.
Absolutely agree. It's one of those things. You're part of the Digital Talk family now, so thank you for joining. But would you like to give a shout out for anyone in particular, or a project worthy of, a shout out?
Yeah, one thing that we do, and we're really proud of that, is we hire from the communities. So our senior developer is a Syrian refugee himself, Hussam. He obviously is a great person, but one thing that we always talk about is whenever we have a new feature that we want to deploy, he says, "Oh, okay, let me go ask my wife," because she's from the target group. So we do like
she's your test guinea pig.
Yes. And she's like, "No, this won't work. Don't do that." And I'm like, "Okay, we don't need to deal with that."
Well, listen, it's been a great pleasure to have you on the podcast, and all the success. Brilliant project. We look forward to hearing more about it.
Thank you so much. Thank you for having me.
If you've enjoyed today's episode, don't forget to rate us and subscribe, and feel free to follow us on LinkedIn. And if you have comments or ideas for future episodes, please send us an email. Thanks for being part of the Digitel Talk community and for listening. Stay tuned.